Hi, my name is Jonathan Hush, and I came to Hope Hearing to treat my tinnitus symptoms. I noticed my symptoms probably about 2016, 2017 when I was in the Marine Corps. My job in the service was shooting howitzer cannons, so 100 pounds of explosives going off right next to my ear. Not too much ear protection is going to help with. So shortly after being that job for probably about a year or two, I really started to notice that really high ringing in my ears. It started off just like really faint, and then as time progressed and I kept shooting more cannons, more artillery rounds, I kept getting more pronounced, more like deep in my ear, to where I could be having a normal conversation with someone, then as out of nowhere it just starts the little like E sound right in my ear. My primary care physician referred me to Hope Hearing. The only place I've been to prior for my tinnitus was the VA hospital. So when I first called in, the phone screening and evaluation to see if I was a candidate was very informative. Pretty much laid out the framework from A to B of where I would be starting, what are the possibilities. The exam itself was very comprehensive. So unlike other places I've been where it's, they just throw you in the little soundproof chamber and raise your hand if you hear some noises, there's a lot more technologies, a lot more like exams involved with diagnosing my tinnitus. So it's impacted my daily conversations with my girlfriend. So she would constantly raise her voice or really project across the room to get my attention, because I couldn't really hear her that well if I wasn't focused on her, watching her mouth move. Ever since getting the devices and wearing them daily and really seeing the change in my hearing and my tinnitus, we can go out to restaurants now and I can be solely focused on her conversation and really dialing in instead of all the sounds in the restaurant just kind of overwhelming and really engaging that tinnitus even more. The staff here has been great. They treat you like family, they really do. Dr. Kellogg has been really invested in both my hearing and how I'm doing every day in my personal life. I would say if someone's on the fence about it, the biggest advice I could give them is it's worth a consult. So it's worth coming in, it's worth seeing what your options are instead of just disregarding it blindly. With the track that I'm on now and the progression that I've seen, I'm going to keep wearing the devices. It's going to keep getting better, I hope. And then whatever Dr. Kellogg and the staff here really thinks best for my treatment plan, I'm going to go along with. Find hope, get relief.